All right, so you have a seroma. What do you do? So to start with, you always call your surgeon. Your surgeon should be helping you navigate this. As a patient, you should never be navigating a surgical complication by yourself. And that's true even if your surgeon is far away. So if your surgeon is across the country in another country, your first call should be to your surgeon and they should help you navigate this. Now, a seroma is just a fluid collection in the area of the surgery, and they're not inherently dangerous, and this is not an emergency. So a routine seroma is not something that should make you go to urgent care or an emergency room. And if you go to these places, it's unlikely that you're going to have someone drain it for you. So it's just a big, expensive waste of your time, in my opinion. When I've been called from the emergency room with a patient with a seroma, my response is, I will see them tomorrow in the office. This is not an emergency thing. It doesn't need to be done in the middle of the night. A majority of seroma drainages we can just do in the office under ultrasound guidance, and often we don't even need ultrasound. So we numb the area up and withdraw the fluid, and the area should go flat. Now, there are some surgeons who will send you to have it drained by interventional radiology, and that's typically because they want the interventional radiologist to place a little drain at the same time. So this is for someone with a larger seroma that we think has a high chance of coming back, and that will allow it to drain through the drain, and then hopefully it will peter out, we can pull the drain and be done with it. I don't often do that method. Now, it can be problematic to leave a seroma for a long time, so this is something you should alert your surgeon to right away if you're concerned. If you leave it there a long time, it can develop a capsule around it, just like an implant does. And once there's a capsule around it, it's unlikely it's going to go away without some surgical intervention or sclerosis. So if the seroma has been there a long time and it's not very large, you can often drain fluid, use some kind of sclerosing agent to irritate the walls of the seroma, and then it will hopefully collapse down flat and won't come back. We can also do that in the office usually. Now, if it's a bigger seroma or it's been there a long time and failed other methods, then we have to go to the operating room and remove that capsule and try again. Now, there is one more thing a long-term seroma can do. It can distort the tissue and make you look weird. And if you've had a cosmetic procedure, it can permanently alter your outcome, so it's not as good as it would have been. So this is definitely something, again, you should be telling your surgeon about right away so that you don't develop problems. Now, the one instance that is an emergency where you should go in right away, potentially even to the emergency room, is when the seroma becomes infected. And when the seroma is infected, it needs to be drained. You need to be started in antibiotics, and often a drain needs to be placed. And it's hard as a patient to know, believe it or not, if there's an infection, because often seromas, especially when there's some dependent edema, you get some redness of the lower portion where the seroma is. And so it can be challenging to know whether it's infected or not. Again, your surgeon is your best resource to figure these things out. So just to review, yes, seromas can be treated as an outpatient. It is not an emergency with most patients. Your first call, if you think you have a seroma, is always to the surgeon that did your operation.